So there's an often overlooked part of facial aging, and that's called the buccal fat pad. The buccal fat pad is a little fat pad that sits well up in our cheeks when we're infants, and it helps us suckle. At least that's the purpose of it. But unfortunately, over 30, 40, 50 years, it begins to slide down into the bottom part of the face. Oftentimes you may see somebody who's older, who's had a facelift, they've got a nice jawline, but it looks like they've got a little walnut sitting right there in their cheek. That's the buccal fat pad. Now we call it a sliding buccal fat pad because if you push on it and you push up just a little bit and you let go of it real quickly, you'll see the skin drop back down. But it takes 2 or 3 seconds for that buccal fat pad to slide back down in there. It's almost, you'll see it sliding back in, hence the name sliding buccal fat pad. So it's one of the things that needs to be addressed in a lot of people where they'll have the jowl here when you do a facelift or a neck lift to tighten up the jawline. But if this area right here is not addressed, they still have an older aged look because there's too much volume in the bottom part of the face. So the way we fix that is to make a little tiny incision on the inside of the mouth and take those fat pads off. They can be the size of a ping pong ball sometimes. They're quite large. Now, younger people will often ask me, can I get my buccal fat pad taken out to address the fullness of my cheek? Yes, but you have to be careful. You have to pick the right person, because if you do it on somebody who's thin, it can make their cheeks look very gaunt or hollowed out, or even make them look unhealthy because the cheek is too hollowed out. Once that cheek pad or that buccal fat pad falls down into here, it needs to be removed. But taken out in the wrong person too early, it can actually make your cheeks look hollowed out. So just make sure that you're the right person. Talk to your surgeon about what's the right opportunity for you and the right procedure for you.